Okay. Okay, we're going to call the meeting to order. First thing is approval of last month's minutes. Any discussion, questions, changes on the minutes from anybody? If not, need a motion to approve.
Motion to approve.
Second.
Moved and seconded to approve last month's minutes. All those in favor say aye. Aye.
Aye.
Opposed?
Abstain. I wasn't here.
Okay. And Sue-Ann abstains. Approval of the agenda for tonight, it will be changed a bit here. So a few things are going to be switched around because of some things we had come up at the last minute. So we'll kind of try and follow it as best we can, but I don't think it'll be exactly on the agenda that was proposed initially. So does anybody have anything else they wanted to do on the agenda? Okay. Okay, we're just going to start by having the county attorney give us some information as far as HFI goes.
Yeah, so there were some questions that were submitted by the health department, a couple of which I will help you guys and answer tonight. Some of the other questions, I've talked with Bob Weaver and Liz, and I will be having a teleconference with Bob and Liz later this week, maybe as early as tomorrow. Those are more attorney-client privilege questions that would be appropriate for a conversation subsequent to tonight's public meeting. The first two questions, though, that I'll address is whether the Health First Kosciuszko and the health department and their partners, they assist residents who are not Indiana residents lawfully in the United States by whether they can by referring them to resources and care medically or in any other way. And then question number two, if not, does Health First Kosciuszko need to create a form for individuals to verify that they are Indiana residents lawfully in the United States for proof and documentation purposes? These questions come out of a new Indiana law that went into effect on July 1 of 2025. It is Indiana Code 16-46-10-3F. And it states that the funds may only be used for Indiana residents who are lawfully present in the United States, period. That language was changed from United States and Indiana citizens to Indiana residents. Okay, so one, the law does require that they be Indiana residents who are lawfully present, meaning they can be citizens, but they can also be lawfully present here with visas or the like. Okay, so that is the lawfully residents. Indiana residents who are lawfully present in the United States, that's the lawfully present in the United States. As far as Indiana residents, that can be verified using government issued IDs. If they don't have a government issued ID, it can be done the same way that the BMV does with mailing addresses, mail showing that it's going to a particular address. As far as forms and whether those should be required, the answer is yes, they should be. There should be a form that documents that they are lawfully present in the United States and they are an Indiana resident. That would satisfy our obligation to make sure that the funds are only going towards services for those persons and not those that are here illegally. There is also a question as to whether or not the health department and the county may want to further require documentation as to whether they are county residents. And that can be done. It could be done on the same form. That would be something that the commissioners and the board should decide and discuss. but it can be done if you guys wanted to verify also that they are residents of this county before you distribute services. As far as referral, if they do not have documentation or if documentation isn't even requested, I mean, referral to other providers can be done. It is just a matter of services of the county, funding of the county in terms of goods or services cannot be done if they are not here legally and if they're not an Indiana resident. Does that make sense, or is there any questions?
I guess the only thing, this may not even be an issue, but I'm not sure, you know, we have one thing that involves the school system where, like you said, the county, may live out of the county, but they come into the county for school, Pierceton. Would that be an issue then? I mean, being a resident of the county, since they may not live here in this county, but go to school here in this county?
I think that most of the services that are done at the school are actually done by the school, right?
Mhm.
We have contracts and MOUs with the school, and the county is not directly providing those services to those students, correct?
Yeah, just us, I guess.
Yeah, so that would not be something that we would need to be concerned with.
Okay.
Correct. But if our contract and our services is with an organization, we do not need to verify who that organization is servicing. That's up to that organization.
So any of our partnerships that we have, we don't have to have them use a form to verify that they're a Indiana resident or a county resident?
As long as the funding is not going directly from the county to those individuals.
Okay,
If it is funding that is going to an organization, then that organization may have certain requirements on its end as to how it uses those funds.
okay,
If we are reimbursing for services to certain individuals, that's something we may want to take a closer look at.
okay.
Yeah.
And if I'm recalling correctly, when we gave money to Whitco and whatever, we prorated the number of students and took the ones that didn't live in the county out of that equation, I believe. So I think we should be, I would think that would cover us for that.
Mhm.
Is that right?
I
We
think
did.
so. Mhm.
Okay.
Sue Ann, did you have anything else that you wanted addressed?
Just if we could identify why the rules were changed and the importance of the county's liability being considered in everything that we're doing.
You're talking about the reason for the procedures
The
that we put
process
in?
change,
Yeah. Yeah. So as we know, there is a new Indiana law that has been in effect now for over a year that requires the county commissioners to sign off on all county contracts. And that's all agreements, whether they be in the form of a contract, an agreement, an MOU, those are all agreements, okay? County commissioners have to sign off on that, and it has to be reviewed by the county attorney as well. That procedure is in place. The auditor has circulated all the procedures for that. I think that you guys, at least administrative folks, are aware of how that works. With regard to the Health First procedures that were put in place, I think there was some concern that some activities of the health department were not in line with the elected officials' policies. There were some things that were being done that the commissioners were not aware of that would be contrary and not in line with policies. I'm not going to go into detail about that at this point. We can have discussions certainly with me, Bob, and Liz but those policies are the responsibility of the commissioners. And we don't want the health department acting in a way that is contrary to the elected officials' policies who are responsible to the citizens that have elected them. So that in a nutshell is the reason to make sure that there is approval up front of the commissioners on some of those matters that are addressed in the Health First Kosciuszko funds that have been cut back but are still substantial. Does that help, Sue Ann?
Do you want to bring up the MOU thing? Dates and dollars changing?
We'll discuss that later, I think. The MOUs, that will have to be a discussion between.
Okay.
Yeah.
So anything else? Anybody have any questions for him? Okay, thank you, sir.
Yeah,
Appreciate you
thank you
coming.
very
You're
much.
welcome.
Okay, I'm going to tell you what the intent of that was.
What was the question? I couldn't hear it.
Did the commissioners approve on Tuesday anything to come before the board? And the intent of changing that rule wasn't to stop anything that was already in process. So we've heard from the clubhouse, we've heard from the food, whatever, we've heard from the Y. The intent was never to stop those things and have to have them start all over again. The intent was to process those. It's still going to come back to the commissioners, but anything new that was received, that we would then put that in place on those. Now, I realize that that document doesn't say that, but that was certainly always the intent. And sometimes the intent gets missed in the heat of the moment. But I believe that that was the intent, was just to get the ball rolling and draw a line in the sand and say everything that you've already thought about, everything you guys have already talked about, then that's passable. It's going to come back to the commissioners anyway. And everything that comes in new, instead of making these people have to come back and come back and come back. Plus, the other piece I want to address is the fact that this board is very important in this process. And I know that some of you feel like you had been pushed down the line because of putting the commissioners first. But if the commissioners have a reason that they do not agree with it, then there's no point in running people through all these hoops if it's not going to get past the goalpost in the end. That's just my thinking. I've watched people come and make great presentations, and we've moved forward on some, what I believe is some really important things that we have done for the community. But I also know that we don't want to put any liability on the county. That's my job as a commissioner. And maybe it's wrong that I sit on this board, but that's where we were put. I mean, I replaced Carrie Groninger. I sat in Dave Wilkins' seat when I was on the council. So that's just kind of where we're at in my humble opinion. And the things that you guys have been able to look at and have been able to evaluate has been wonderful, because I think we've learned a lot about a lot of things. And I think that is critical to making good decisions for how we're spending this money. So I applaud you all. And please don't ever think that it was ever intended to decrease your importance in this process, because it absolutely was not. It's the liability factor. And thank you for letting me speak my piece.
Thank you, Sabrina.
Did she? Was there a question? I can't hear her again. What did
She just said, thank you.
Okay.
While we're on the funds process, I do have just an opinion, I guess. I don't know if it would actually work or how any of you would feel about it, but I was thinking of how to keep the committee giving me input on certain proposals. So I was thinking, once I get a proposal, then I would send it out to Bob and Dr. Waldo. They would give me their okay or not okay. If I got an okay, then I would pass it along to the committee via email. And then we could either meet in person and talk about it, or we could just email back and forth just to get their opinions on things, and their knowledge. And then it would go on to the commissioners and follow the process. So I didn't know if that was okay to do or not.
I think that might be an Ed question. That's above my pay grade, honey.
Yeah, I think that the way that the policy was adopted is that the first step after Bob and you, Liz, would be the commissioners. And that is, are they interested in pursuing this? And if they are interested in pursuing it, then they would want the input of the professionals on how best to go about it.
And that would just be, they would just be judging it on the liability part of it and.
Liability and policy.
Mhm.
Mhm. Mhm.
So you're saying then that us even giving input to her wouldn't be acceptable? Is that before the commissioners get it, I'm saying? Before,
I mean, I'm not suggesting a limiting of input per se. What I'm saying is that you may be spinning your wheels that the commissioners aren't going to approve. And that's why the policy was set up, that if there is something that is being proposed, first stop is the commissioners, so there's not wasted time.
then, but I look at it the opposite way too. I mean, it could be the opposite, could be the effect of the commissioners say yes, and we say, it doesn't seem like a good idea, so it gets stopped there, because we don't want to spend the money, or the health department doesn't want to spend the money, so it could go either way, so there could be a no, either way you do it, I guess, that's my question. You could still get a no, even if the commissioners.
There still could be a no, but the first stop is the commissioners.
Okay. Thank you. Anything else? Anybody?
Yeah, my general, I've appreciated being invited into this space. My thought is hopefully we bring legwork and experience to the table. But the reality is we are not a legal entity. We're not a government entity. This group today is just an advisor inputter. And so to have to operate within the rules of public government meetings when we're not really a government entity, I think maybe makes it more difficult for us to give our input and insight. And so from Liz's point, would we be able to give insight and experience point of view to help the process without it being an official gathered meeting? Is there a different way that maybe is more efficient to help Liz in her work, to help the health board, which is really the governing body that has to move it up the chain? So I'm just asking that question. It feels like we're kind of restricting ourselves to operate very specifically in line with public meetings, government meetings, when we're just an advisory group in practice and in standing. So that's more of my question with Liz going, once it gets through the appropriate processes, is there a way that she can get input or feedback from people who maybe would provide some valuable insight and then kind of keep it moving? Because at the end of the day, the health board has to approve these back to the commissioners, right? And so we're kind of, again, the legwork to get to the health board. So that's just more of my.
Yeah, there's nothing that prevents Liz from having conversations with individuals of the board, but any official decision of the board is required to be done at a public meeting.
Yeah, and again, we're not the board. We're really just.
Well, you are a committee.
We're a committee.
And so that's the open door law still apply.
Okay.
Yeah.
That's good to know. We are a
Yeah.
committee.
Yeah.
Formed by the health board.
Correct.
Okay, gotcha. Thank you.
Spending government money also. That's
Well, we're
the other
not, but
key.
we're not. We have no authority.
Yeah,
We're just moving an idea forward to,
Yeah, you're authorizing the moving forward of it. Yeah, I get it. I get
we're
it.
recommending things. We're not authorizing anything.
And what I learned too, because I had reached out to the Department of Health, Indiana Department of Health attorney, and kind of asked her which she said, talk to you. But she had said that we are only considered a governing body because we meet in a governing space. So if we were to meet somewhere else, then we wouldn't have to, be a public entity. I guess it's,
You wouldn't have to broadcast. You wouldn't have to televise. That's the difference.
mhm.
Yeah, the committee is still subject to open door laws in which the public is able to participate.
Okay.
Okay. Anything else, anybody? Okay, thank you.
You're welcome.
Yes, thank you very much.
Thank you.
Okay. Well, I think we're gonna flip around a couple of things here a little bit. Do you want to go over the budget then first?
Yep, yeah. Mhm.
Budgetary items, since we have to consider some money down the road here.
Okay, so I got an updated 2025 budget from Sarah. And this one has the remaining money of $364,737.41 for 2025. Everybody get a copy of that? Okay. So then on the sheets that I created for 2026 plan options, you'll see that that number for 2025 actually increased a little bit because of that. So we're sitting on around 305,000 for 2025 now. And that is if we were to take 60,000 instead of 50,000 out for 2025. So that was my question for the committee today. If we could increase that 50,000 that we talked about at our last meeting to spend in 2025 to 60,000.
Anybody?
Okay, are you speaking of the reserved amount? I'm sorry, you lost me, honey.
No, no, you're fine. Not the reserved amount. So last meeting I had asked for more money to spend this year.
Oh, okay.
Yeah, so we had agreed upon 50,000. But I was wondering if I could increase that to 60,000, just in case there's another partner, because I know there was one other that I was working with that may be approved or not approved, but just to have that option to spend that there or on other programs.
And you're saying that the 60 versus 50 would be the 2025 money that could now be utilized to make 2026 decisions?
No. So the 2025, it's just resembled here on the plan option. So that would make the 2025 number of 305 more, or well, it'd make it less if we decided not to do the 60,000.
The 305 available includes
It includes
the
60,000.
60. Yeah.
Mhm. So we'd be looking about 295,000 if we didn't do 60, if we did 50,000.
That seems like a reasonable request. I mean, it's only 10.
Mhm.
I mean, I realize a whole lot of 10s make a whole lot of money, but I mean, I would think that would work. I'd move we approve.
Okay, we had a motion to approve Liz's request.
A second.
Moved and seconded to approve the request for $10,000 more dollars for 2025 budget. So any other discussion, question?
Not for 2025, but that's the plan options for 2026. That's what you're looking at. There's two different ones. The only changes that I made besides the amount there, we took off mileage because I did not know that that was included in the like personnel costs and all of that. That's already taken out of the uncommitted amount. So that $5,000 gets added back in. That's more money that we have. And then I did add, we're going to be talking about the YMCA proposal today. So you'll see YMCA indoor fitness. The reason I put it on for 2026 is because the entire project goes from October 2025 through April 2026. And in order to do that full project, we would need to fund the full amount. But because of funding purposes, we did two different proposals. So the one that we're approving today or recommending today would be the one for October 2025 through December 29th, 2025. But that's included on the sheet just to represent for 2026. That amount would be $11,085. And then new partners, that would just be any programming that we wish to take on that we're doing in 2025. Or if we wanted to do other partnerships in 2026, there's $60,000 for that. So that's option 1.2. And then the other option would be using the school health liaison that we have so that we can still stay connected with the schools.
So you're saying option 1.2 does not fund the school liaison going
No.
forward?
No.
Okay.
So 1.2 does not fund a school liaison, and then 2.2 does.
Okay.
I was going to say, are we not required to fund the school liaison?
They recommended that we do. I don't think
Okay.
it's an actual requirement.
I-
But yeah.
So, yeah, at the last meeting, we pretty much agreed that we think we need to continue to fund the school liaison,
yeah.
basically. So, unless there's some other discussion, I don't know, we don't have unless somebody has some other option to come up with, I don't know that there's any choice in the matter. One has it and one doesn't.
Well, I felt like when I read over what her report said, she's touching a lot of bases and doing things that maybe the schools don't have the wherewithal to do without her coordinating them. So I would think that would be a plus.
And my thought for that too is, this is her first year in the schools. The schools are doing a lot of good things, but having that relationship with her, they'll be able to open up, I think, more doors, and having her just help out with the students and with the administrative things that she does.
So is there any other discussion as far as any of the other amounts on the proposed budget for the next year?
So Liz, the rest of the line items would be kind of what your intentional direction would be
Yes,
based on, those aren't kind of nailed down MOUs yet, but
they're
but
not
that's-
nailed down.
That's what you would pursue to kind of hit the budgeted spend,
Yeah, in order
that
to
we have,
hit all
yeah.
of our KPIs,
right?
we would need to spend the money in some sort of way that I have it here on the sheet.
Mhm.
We could, take and place different funds, different places, but this is how I've kind of mapped it out, how it would be, and it would benefit everybody, and we'd still be able to have the same partners. The only thing on there that we are not addressing now is our teen pregnancy education KPI. That one was an added fourth KPI. So my thoughts are, I'd like to address all of them, but if we could focus on the 3 priority KPIs to do that with the money. So that would be another discussion if we wanted to have it, is do we want to keep 3 KPIs and cut one out so that we can focus more of our money on those 3 and make more of a difference?
Yeah, I mean, some of this is the response to the state's funding going down and us having to manage that. And I would say, going back to what are the most critical KPIs we believe we have to do our best to move forward. The luxury, so to speak, of adding optional things we'd like to do, I just think we don't have the capacity to recommend added things, even though we'd like to, and there's certainly more needs in our community than just the KPIs. I think the state's kind of put us in a limitation to not really have the luxury to doing beyond what kind of the necessary things are. So my recommendation would be to defer that to a future date. Or if we circle back to recommending releasing some capital reserve to maybe be additive into the budget, that's something to me, we could look at in the future. But
Do we know the teen pregnancy thing, was that still a question mark? How much we could do in the schools or something?
Yeah, I haven't heard, because I heard that the school standards may have changed, but I have not heard any confirmation on that
So
yet.
we don't even know if we can do it at this point.
Mm-mm. So I'll just say all four. So we have decreased the number of early syphilis cases identified in Kosciuszko County, primary, secondary, and early latent syphilis from 7 in 2020 to 4 in 2029. Under the maternal and child health core service, we have 2, and that is decrease the rate of women who have no early prenatal care from 30.5 in 2022 to 26.5 by 2027. And I can say that that has decreased, so that's good. The second one was decrease the rate of teen births from 18.8 in 2022 to 16.9 by 2028. And then under the chronic disease core service, we have increased the average age of death related to heart disease being 76.5 from 2020 to 2024 to 78.5 from 2025 to 2029.
and those were the local KPIs.
Those are the
that we-
local
yeah.
KPIs, yes. At this point, the only statewide KPI that we aren't addressing is trauma and injury prevention.
You said we might get that through a partnership though, with all type of
We
thing?
may, yeah. And that would be through the YMCA that we'll talk about.
Okay. So any other discussion as far as the 10,000 and any other changes anybody would think about making on the line items? Anything?
I would recommend option 2.2 that does include the support of the liaison, school liaison in the plan.
And I'd second that.
Okay, moved and seconded to try and adopt option 2.2. And with the option of deciding on the $10,000, right? More or less, whether you want to include that. The teen.
Oh, yeah, that was still sitting out there, wasn't it? No, not the teen pregnancy, the extra 10
Mhm.
Right, yeah,
to go from 50 to 60.
right.
Oh, no, we had that
We-
one. We had Suanne
I
and,
think I moved to
yep,
do
you
that.
moved and
Yeah,
then.
I know we motioned and seconded. I
Yep.
didn't know if
Yeah.
we called for a vote.
Oh,
I have it written down that we did.
Okay. All right.
So, but that's the way we want it, more or less, to thought of, right? To
2.2 does not currently fund into that fourth KPI, right?
No, they all do. Mhm.
Does it include the
Both
fourth?
options do. So it just went down.
Oh,
So 1.2, oh no, they're both the 10,000 now.
okay, so I will amend my motion to recommend 2.2 excluding the fourth KPI due to limited funds.
and whatever I need to do to make what you said happen, I do that.
Okay. So, any other discussion? Questions? Okay, all those in favor say aye. Aye.
Aye.
Okay. Opposed? I guess we don't have any, so, yeah, that's the deal there. So, okay. Let me see. Okay. You have down here the expenditure planning and potential options. Is that what we just did?
That's what we just did.
Yeah, right,
Mhm.
okay. Okay, so we'll go backwards here and then
We can address the proposal tracking form because that'll just take 2 seconds.
Okay, go ahead.
Okay, so the initial proposal tracking form that we had when we first got the funds process, that we will not be using. Sarah has created a form for tracking purposes, so we'll be using that.
Okay.
And that is just to, along the process to say who did what with the MOU proposal.
Okay. So. Any questions, anybody on that? Okay. Then we'll go back to the request for funding, I guess.
Okay. So the YMCA put a proposal together, and it is to have indoor fitness in the rural communities. So there's 3 different towns that they've been kind of discussing this with to see if they would be on board. But they would have 2 different programs. And the first one is the Enhance Fitness. And that is provided by, and correct me if I'm wrong because they are here, that is provided by the YMCA. And then there's a Matter of Balance, and that would be provided by Purdue Extension. So both of those are addressing the wellness of seniors and the fall prevention aspect that we've been talking about in our meetings lately too. So, but if you have any questions, they are here. And it's in the amount of $12,005. And that's the one, it goes from October 2025 and it stops in April 2026. If it goes really, really well, the YMCA plans to adopt the program.
What are the 3 communities that are?
Amy, can you come up to the microphone? Yes, you're fine. And then just press the button.
So it's the help communities. It would be Mentone, Milford, and Pearston. So this actually came from the help program that we had participated in 2022. One of the 6 programs that was identified was providing indoor fitness to active older adults. And so this would meet that specific program expectation, as well as use our communities who are used to us kind of testing things on them. Their ability to try something that's different and seeing if this works. And then I believe, Jim, this gives him the ability to make the case to the board that decentralizing this process would be helpful. And they would hope to be able to further bring that into other communities as well. So this is building upon something the county's already supported. Does that answer your question?
Thank you.
So if my math and calendar's right, this is a 6-month kind of trial that funding of $12,005 would cover the trial period. And then it would be reassessed if this is kind of a winter thing because it's indoor, you'd reassess kind of continuing it in the following fall. Gotcha.
Any further questions, discussion, anything there? Okay, I guess need a motion. Want to go ahead and approve that or not?
I move that we move forward with this. I think it sounds like a great program and to get out to the other communities. I think it would be great.
I'll second. So moved and seconded to accept the YMCA program. Any further discussion? All those in favor say aye.
Aye.
Opposed? Okay. And that was it for that part, right? That's all I needed. Okay. Let's see. Well, you don't have anything else for the HFK funds process on this,
No,
right?
that should be.
Okay. Then I guess unless there's something else, we'll move on to old business.
All right, so With the MOUs, we did have Livewell Kosciuszko, they're under the 30-day public notice. And then the light MOUs, we have the 48,000 back in the Health First Kosciuszko account. And then as far as the pre-purchase agreement, we'll have to talk with that with the attorney. And then he did address all the local decisions. So.
So those two MOUs are just in process. They're moving ahead. The light and the live wells.
No, so the light are not moving ahead, and then the Livewell Kosciuszko, it has gone through the whole process. It's in the 30-day public notice period.
The live well one.
Yes.
Okay.
Livewell.
Light one is not moving.
No.
Okay.
No. And the Livewell
Okay.
one, that is for the Breathe Well and Chronic Disease and Obesity Coalition.
Yep. Okay. Thanks.
Okay. Anything else under old business?
So that one was not put on the agenda today. So it's a later discussion.
So will somebody refresh my memory where we're at with the clubhouse piece of it? The meeting that I missed, I've lost all trail and too many other things going on in between.
Okay, so that was one of the old, not MOUs, proposals that we had that we were trying to address, and we've already addressed it in 2 of our meetings. We were planning on addressing it tonight. It was not added to the agenda. The process that I have, let me find it. So I was told that it needs to be reviewed by our health officer and then the commissioners, and then it will come back to us.
What's the question?
She doesn't understand the difference between the YMCA being on the agenda and the clubhouse not being on the agenda.
And
I do not have an answer.
okay.
It's October 27th. It'd be probably 2026.
Okay. Anything else on that? New business? Mid-year report?
So mid-year reports, Lakeland Christian Academy, they turned theirs in, and I think it was the last meeting, they turned it in that day, so we didn't have time to review it. But they are addressing pretty much everything that they did last year with the HFI money that they received. They purchased food and water to distribute to the students who don't have lunch. Feminine hygiene products for all the restrooms on the LCA main campus, basic clothing and hygiene items they purchased, and then the emergency medication they purchased, or they're going to purchase with the second half of the funds. Purchase age-appropriate sex education material for the lower and main LCA campuses, and then emergency kits for classrooms, cafeteria, and kitchens. And then the school health liaison, we kind of talked about already, but they've been going around each school and helping with immunizations, records, getting kids prepared for the upcoming school year. And that's been kind of releasing a little bit of stress on the nurses so they can focus on other things. They did have at Tiffany Valley an immunization clinic, which turned out very, very well. But yeah, she's just helping out however she can in the schools, and they've been pretty receptive to her. So.
Okay.
And then the next thing would be, so NIMCHN, which is the Northern Indiana Maternal Child Health Network. They came back with their mid-year report, and they were not needing to spend all of the $84,000 that we had in the MOU for them. So I did ask her via email, and she said if we could roll it over, that would be good with her, or she could still spend it on kits or testing, anything to do with the syphilis KPI. So my thought was to just do an addendum to the MOU since she doesn't need it for this year, and then just have her reapply to address that KPI next year in 2026. And it would be $30,000 that would be put back into the HFI account.
When did that start?
So they received the money in April. So that's part of the reason why they didn't need all of it, because they didn't use it for January through March. So they requested 84,000. They received 42,000 in April. It was like the first week of April. They used from April through June at the time of this mid-year report, 9,000. And then they plan to expend $43,750 from July through December. So the total expenditures from April through December would be 53,000 roughly. So they would still need us to provide 11,000 so that they can finish out the year, but that 30,000 would come back to us. So I guess my thing was, what are your thoughts?
I would be a fan of modifying the agreement to align with their expected spend and then reconsider continuation for 26 separately. In other words, recoup the difference.
I would second that.
We got a motion and second. So any further discussion on what she's looking for there? Okay, all those in favor say aye.
Aye.
Opposed? Okay. Anything else under new business for you? Okay. Anybody else? Anything else to discuss under new business?
That's the button
Yeah.
on the microphone.
I know that the agendas are subject to change, and I think, Bob, you create the agenda?
Now I create the agenda.
You create the agenda? So can we add the clubhouse to the agenda?
That would be under the, I don't believe so, because it has to go through the process, is what I was told. So that process that I just said,
Where we have to go through Bob and the
health officer.
health officer, the commissioners, it has a,
So since April 10th, it's never gone to Bob?
No, everyone has received it because we discussed it here at the committee. So those go to all of the, when I send them out with the agendas, it goes to all of the committee members. It goes to the health officer, it goes to Bob, and it goes to normally Sarah and then my assistant Renee.
Okay, so the agendas are subject to change, so can we add it to the agenda? Why wouldn't we be able to? It's already gone to them.
That's not part of the process, is what I was told. So I don't know how, that's the first time I've been asked that, so I'm not sure.
this is not one that has to go through the commissioners first, or it does?
Well, so did the
This was-
YMCA.
This was already in the pipeline,
But they rerouted it. So it was
but
supposed to go
so
to.
was the Y,
And they didn't reroute
and
that.
they didn't reroute it.
So who can make a motion to add it to the agenda?
Well, I don't know that we can do that if she doesn't feel
I
comfortable.
can't do it.
Yeah.
I have to go by
So
what I was
if
told.
we've been told and she's been told, then. she
Who
can't.
were you told that by?
Sarah.
So Bob's office.
Well, it's,
Yeah, and I had asked Sarah if he had reviewed it yet, and she said no. But I was told the other day that he.
Well, the problem is if it can't go to the Board of Health next week, then it wouldn't go until October. We wouldn't have the funding, and basically we're looking for funding for Chris's position. We do have some funds from K-21, but of course they wanted, us to have additional funding. They don't want to fund the entire thing.
When does Chris's position start? Like now?
His position has been ongoing, but the funding. Yeah, but the funding from our corp ends at the end of August.
Yeah, and I had brought up the funding was an issue, which I didn't know prior to, or I didn't remember one of the two. But when you addressed that with me the other day, I did pass on that information.
Okay, so can we add it to the agenda tonight and then take it to whoever you've missed, even though you said you've sent it through the process? I'm just confused as to why we're being treated differently.
I don't have an answer for you.
Well, somebody does.
I have a thought. How about if we add it to the agenda, if we pass it, that's fine. It still has to have an okay from Dr. Waldo.
Yeah,
If we get an okay from Dr. Waldo, then it's good to continue proceeding. And then we would have an answer. I mean, am I oversimplifying this or not?
I think.
Bob,
Dr.
what do you
Waldo-
think?
Well, I think Dr. Waldo he could show up tomorrow morning
that'd be great.
and
My-
tell me, it's possible, but I don't know.
Because
Well,
Anita's meeting Wednesday is correct.
My thing was I got a verbal okay about the clubhouse. And then I was told that this is the process
You got a verbal okay from
from Dr. Waldo.
Dr. Waldo. Okay,
But had he received the one for the clubhouse?
The
yes.
proposal,
Yeah,
yes.
yeah.
The proposal, yes. He has had that as long as we have had that.
I'm very comfortable with Dr. Waldo and Bob taking the opportunity straight to the health board next week. I don't think it needs to come through us. It doesn't have to. I don't think. We've already reviewed it.
Yeah, you've reviewed it
So-
twice.
So at this point,
The authoritative positions can take those straight to the health board meeting next week if the
But
chair,
it's
if the
all
chair is
up
comfortable
to-
with that.
Yeah, it's all up to, I got the okay from Dr. Waldo. I'm not sure if anybody else did. I did pass along that information. And then I have the commissioners need to review it as well. So
Same with the YMCA's.
so what would be, I'll just ask, what would be the worst that would happen if we passed it here? Dr. Waldo says, okay, it goes to the Board of Health and you're fine. If we pass it and Dr. Waldo says, no, it's a stop anyway.
Couldn't the health board pass it with the understanding that it must also be passed by the commissioners in the next step?
Yeah.
Something just simple like that.
Yeah, same with the Ys.
Because like I said earlier, this new process wasn't intended to stop anything. It was to draw a line in the sand and keep moving things forward.
But that's already, isn't that already the way it would go? It would go from the Board of Health to the commissioner anyway.
Yeah, the commissioners meet on the 29th. Board of Health
Yeah,
meets
after,
next
yes,
week.
after. Their process right now is
You
Dr.
go-
Waldo needs to review commissioners and then coming it back here and then the Board of Health and then the commissioners. But I agree with everyone here. I had a verbal okay from Dr. Waldo. I don't know about the commissioners, so as long as they would approve it later, I'm okay with moving it on as well.
And we're talking about $15,000?
$15,000 because the initial was 140,000. They are finding other funding. We're not able to do that.
Yeah, we understand
unfortunately,
that.
with the money that we have. So 15,000 is what I was recommending.
So if he approves it in the next few days,
Yeah,
I'll see to it that it is heard by the board.
That it could get to the health board then.
Yes.
So do you tell us, Bob, do you want us to make a motion and we pass it? Or do you want to bypass this board? I'd feel a lot better if this board said yay, but
Is that all right?
Sure, go ahead.
Then I will make a motion to recommend approval of the $15,000 recommended support and to recommend the board consider any additional funds out of the capital reserve.
I'd second that.
All right.
So if I receive that, I'll see to it that it
Yeah.
gets to the board.
Okay. And you have it to give
You
it to
have it.
Bob? Or do you want me to
He has it, but I have it too.
Okay,
Yep.
perfect.
So
Thank you.
we're just stuck with the next step is getting Dr. Waldo to agree. And then it goes to the Board of Health, and then it goes to the commissioners, and you're home
Yep.
free.
Mhm.
Yep.
Problem solved.
And they will pass it with the contingency that the commissioners pass it also.
Yes.
And the funding then you said is going to come out of,
Yeah, I recommended 15, which is what per Liz's budget, she feels like that's all that's possible out of the program funds. But I'm adding that a recommendation for the health board to consider additional funds out of capital reserve, which again, that's kind of up to them. So I'm just saying if you'd want to support them at a level beyond what we're capable of, you could consider releasing some of the capital reserve, but that's on the health board to decide that.
And then we can revise the MOU.
okay. So everybody
On the same page.
approval on that? Okay, so,
Thank you.
Thank you
We
so
just need to
much.
vote.
I do appreciate you guys.
okay, well, we'll have an official vote then. All those in favor of what we just explained, say aye.
Aye.
All those opposed? No, nobody, so we're good. Anything else? Okay. Then the next meeting is scheduled for Wednesday, August 27th here. And so anything else? We're good to go. We're adjourned.